Healthcare on Maui is at a crossroads as the Maui Memorial Medical Center transitions to a new public-private partnership with Kaiser Hospitals. The transition is just 3 months away, and to provide us with an update, we have Dr. Barry Shitamoto in studio with us, the Hawaii Health Systems Corporation, Maui Region CEO. Did I get that right?
Yes.
Okay, so can you provide us with an update about the transition? Is it still going to take place as planned on July 1st?
Yes. Number one, the transition will occur on July 1st. There's so much to do as we are down to our last 90 days, last 3 months. Kaiser has been very engaged over the last, I would say, 6 months, but more so recently. And as we wind down towards July 1st, there are so many activities and transition activities that we need to get done that require just about everyone's input from every discipline in the hospital. So it's a big task.
I can imagine.
Yeah.
So what, people who are less familiar with it, what led to the transition in the first place?
Healthcare is a very complex discipline. It requires coordination between so many people and services, and it's just really, really hard. What makes it even more difficult is our reimbursement has been going down, and our remote location, being here on Maui, also makes it more difficult to attract all the specialty services that we need that you might find in a big metropolitan area. So as we were moving forward many, many years ago, and I give credit to the many board members and our leaders at the hospital who had the foresight to think about this, work hard for this, and make it happen, our private-public partnership legislatively. This allows us to expand our services and not shrink our services, to keep our services on Maui, keep our community here on Maui rather than to go to Honolulu or elsewhere for services. So it's just a wonderful opportunity that we had more than any other neighbor island, like the Big Island or Kauai. So we've been really lucky and blessed.
So if you could tell us what this partnership will mean to both the community, the staff, and the people of Maui.
Kaiser was one of the two suitors that gave us proposal on the Maui Regional Board. The other was HPH. We had two wonderful proposals. Kaiser's proposal was very, very good for our community and for the state. What it means for us, Kaiser is a big organization nationally with great resources and great processes, and they do healthcare very well, as evidenced by their large membership all throughout the country. They'll be able to bring their processes here, improve our processes here, our services, our deliverables. They'll expand our services and gives us that opportunity to really provide our community better health care.
With Maui Memorial Medical Center being the only acute care facility on island, is this transition going to have any impact on the level of services to the people of Maui? Is it going to improve, be the same, or is anything going to change because of it?
I think our community is just right geographically, and the way everything is situated, just by having one hospital. Some people think it's a disadvantage. However, having one hospital puts all the resources in one area, and that is why we're able to provide many different services all in one location. If we were, for instance, the Big Island, if you live in the Kona area, whereas their population on the Big Island is as great as Maui. However, it's split geographically over 3 large areas, and you can't really get from Kona to Hilo very, very quickly. And we're lucky here on Maui that we're 20 minutes away from the hospital, from almost any spot. So that gives us a great advantage, and that's why it was one of the blessings that we have on Maui.
So being one of the biggest employers on island, what can you tell us about the staff and just their abilities and how they've been able to serve the community so far?
I mean, the hospital is an economic driver in our community, as you know, having employed so many, approximately 1,600 employees, many of whom have served for decades. They're all talented nurses, physical therapists, radiology technologists, and other technicians, but they're all very talented, all very well trained. Going through the transition over the past 2 years has been extremely difficult for them and for their families, but they continue to serve selflessly. As we go through this difficult transition, and as it gets harder and harder the next 3 months, they continue to be dedicated to our community and to our patients. So I give them lots of credit for their extreme dedication to our healthcare on Maui.
With that said, we look forward to the 3 months ahead and that transition that's going to be taking place. We'll have more information for you on our website. For Maui Now, I'm Wendy Osher with Dr. Barry Shitamoto.